Hello, my name is Jessica and I'm a nursing student. And today I'm going to be performing a head-to-toe assessment. So that means I'm going to be touching, listening, and palpating different body systems from your head all the way down to your feet. Is that okay with you?
Yeah.
Can I get your name and date of birth?
Michelle O. And then May 29th, 1993.
Okay. Do you have any allergies?
Nope.
Okay, so general assessment, she is an age-appropriate female. She is alert, responsive, does not seem to be in any distress or pain. Her hygiene is good. For alert and oriented, can I get your name again?
Michelle,
Do you know what city we're in?
Reno, Nevada,
Do you know what year it is?
2020.
And do you know why you're here?
A head-to-toe assessment?
Okay, so she is A&O times 4. Okay, for subjective questions, are you taking any medications?
No.
Are you currently in any pain?
No.
Do you exercise?
No.
Have you ever or do you smoke?
No.
Have you had any previous head, neck, or spinal injuries?
No.
Are you having any trouble breathing?
No.
Any changes in your heartbeat?
No.
Have you had any previous abdominal surgeries?
No.
Any changes in your abilities to move and your range of motion?
No.
Have you had any vision changes?
No.
No? Okay. Okay, so now I'm going to take a look at your head.
Okay.
So on inspection, her head is normal cephalic. Hair distribution is even. No signs of infestation, no signs of alopecia. The occiput is intact, no injuries. And so to chest, cranial nerve is 7, facial nerve. I'm going to have you raise your eyebrows, smile, and puff out your cheeks. So cranial nerve 7, facial nerve is intact. Okay, so next I'm going to be looking at your eyes. So on inspection, her sclera is white. There is no icterus present. There's no discharge. Also no lesions. Could you pull down your eyelids, please? And her conjunctiva is also clear. Next I'm going to be shining a light in your eye, okay?
Okay.
And her pupils are equal, round, and reactive to light. So I'm going to test for accommodation. Can you look at the wall for me? And then my finger. Okay, so she's also reactive to accommodation. So her pupils constrict and converge. Next, I'm going to have you follow my pen, and I'm going to test for cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens with a 6-field cardinal field of gaze. So just follow my pen. Okay, so cranial nerves 3, 4, and 6 are intact, and no nystagmus noted. Okay, so next I'm going to inspect your mouth. So her lips are smooth, even, and bilaterally symmetrical. They're also pink. I'm going to have you open your mouth and say ah.
Ah.
One more time.
Ah.
Okay, so the uvula rises and falls symmetrically. Her teeth are intact, no signs of dental caries. Gingiva is pink. Oral and buccal mucosa are also pink. No open sores or lesions. Her tongue is smooth, lightly rough texture at the top, and her tonsils are 1+. Chest. So her chest is bilaterally symmetrical. Muscle distribution is even. Her chest falls and rises spontaneously. No evidence of labored breathing. No signs of ecchymosis, erythema, or excoriation. Next, I'm going to listen to your heartbeat, okay?
Okay.
So I'm at the right sternal border, second intercostal space over the aortic valve. S1 is 2 noted. S2 is louder than S1. So I'm at the left sternal border, second intercostal space over the pulmonic valve. S1 and S2 noted. S2 is louder than S1. I'm at the left sternal border, third intercostal space over Erb's point. S1 and S2 are even. I'm at the fourth intercostal space, left sternal border over the tricuspid valve. S1 and S2 noted. S1 is louder than S2. Can you lift for me? Thank you. Lift a little bit higher. I'm gonna go right under your chest here. So I'm at the fifth intercostal space, mid-clavicular line, over the mitral valve. S1 and S2 noted, and S1 is louder than S2. In all spots, there is a regular rate and rhythm, and no extra hard sounds or murmurs noted. Next, I'm gonna inspect your upper upper extremities and your lower extremities. Okay.
Okay.
So upon just inspection, skin tone is even, no signs of erythema or pallor, no signs of ecchymosis. I'm gonna go ahead and touch. Okay.
Okay.
So you have any pain?
Nope.
Any tingling or numbness?
Nope.
So I'm gonna look at your elbows. So olecranon process is intact bilaterally. I'm gonna look at your hands. Okay, so I'm gonna, cap refill is good, under 2 seconds. I'm gonna take your pulse. So radial pulse is 2+, and regular rate and rhythm. Radial pulse is 2+, regular rate and rhythm bilaterally. Okay, so then temperature is even throughout, and there's also no evidence of edema in the upper extremities. Okay, so next I'm going to do your lower extremities. On inspection, there is no signs of ecchymosis, skin tone is even, no scars or lesions present. I'm gonna go ahead and touch, okay?
Okay.
Are you feeling any pain or tenderness?
No.
Any stinging or tingling?
No.
Okay, so I'm gonna do temperature. Temperature is even throughout. I'm gonna do peel pulses. So the dorsalis pedis pulse. That is 1+, regular rate and rhythm. And this one is also 1+, regular rate and rhythm. Okay, next I'm going to check for edema. So I'm going to press on her tibial plate. No edema present. No edema present. Okay, so next I'm going to listen to your lung sounds. So just general inspection. Her chest looks symmetrical. Her breathing is even and unlabored. No use of accessory muscles. There's also no evidence of lesions or scars. So now I'm going to go ahead and listen. So I'm going to have you take a deep breath every time you feel my stethoscope touch your skin, okay?
Okay.
I'm going to have you lift your shirt. And one more time. Okay, so on the front, she has bronchovesicular breath sounds more centrally or medially, and then as we go laterally, she has vesicular breath sounds. Her lungs are clear to auscultation with no adventitious breath sounds. Okay, so next I'm going to listen to the back of your back into your back, okay?
Okay.
So in inspection, her scapulae processes and spinous processes are intact, no sign of skin breakdown. Her muscle distribution is also even. So I'm gonna have you take a deep breath every time you feel my stethoscope.
Okay.
And one more time. Okay, so upon auscultation, her breath sounds are bronchovesicular medially, and then as you go laterally, it's vesicular, and her lungs are clear to auscultation with no adventitious breath sounds noted. Okay, so next we're gonna do abdominal assessment. So upon inspection, her skin tone is even. No signs of erythema or ecchymosis. No signs of excoriation. There's no scars present. Abdominal is also non-distended. So now I'm going to go ahead and listen, so you can just breathe normally. some of the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, so her bowel sounds were normal, active in all 4 quadrants. Next, I'm going to be doing some touching, okay? So let me know if you feel any pain.
Okay.
So light touching. Any pain or tenderness?
No.
So muscle tone is even, no signs or masses felt. So I'm going to do a little bit harder now, okay? A little bit
Okay.
deeper. So any pain?
No.
Okay, so muscle tone is even, no obstructions or masses felt. Going back to bowel sounds, if no bowel sounds are heard, I would have to auscultate each quadrant for at least 5 minutes before I can say that she has no bowel sounds. Okay, so next I'm going to check for her costovertebral angle tenderness. So let me know if you feel any pain, okay?
Okay. No.
No. And then one more time.
No.
No? Okay, so she's good. Okay, so next we're going to assess your upper extremities. So upon inspection, her arms are bilaterally symmetrical. Joints appear to be in alignment. Muscle development is even. So I'm going to have you just mirror my movements.
Okay.
So we're going to go raise your arms for flexion, behind you for extension, out for abduction, and back down for adduction. So now I'm going to have you flex at your elbow for flexion, then extension. I have to flex your elbow like this. So inward for internal rotation, outward for external rotation. Okay, so next I'm going to do muscle strength. So I'm going to have you push me away. Okay, and now pull me towards you. Okay, and now push out. And then push in. Okay, and now I'm going to have you squeeze my fingers. Okay, so she has full range of motion in her upper extremities and her bilaterally, and her extremities and strength is also a 5 out of 5 bilaterally. Okay, so next we're going to do your lower extremities. Upon inspection, her lower extremities are bilaterally symmetrical, muscle distribution is even, and joints appear to be in alignment. So now I'm just going to have you mirror my movements. So leg out for flexion, back for extension, the other one, flexion and extension. Have you put it out to the side for abduction, back in for adduction. Next one, okay? I'm going to point toes out for external rotation and toes in for internal rotation. Now the next one, external and internal rotation. Have you bend at the knee for flexion and for extension. Have you stand up on your toes for plantar flexion, and then point your toes to the sky for dorsiflexion. So I'm gonna have you take a seat. Okay. So now we're gonna do muscle strength. So push up and push down, push up, push down. Okay. So I'm gonna have you push out for me. Okay. And then push in. Okay. Push out. Okay. And then push in. Okay. So now I'm gonna have you step on my hand. Push down. Push up. Okay, and push up. And push down. Okay. So her lower extremity, she has full range of motion bilaterally, and her muscle strength is also 5 out of 5 bilaterally. Okay, so that'll conclude my assessment today. Is there anything else I can do for you?
No.
Okay.